Hello, and thanks for joining us. Welcome to the 2022 American Diabetes Association Ask the Experts series. Today's topic is, what does an exam look like, and can my vision be saved? My name is Carla Cox, registered dietitian and certified diabetes care and education specialist, and your host for today's program. Remember that our Ask the Experts series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press *3. That's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. We invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit about why we're here today. The American Diabetes Association, together with visionary partners, VSP Vision Care and Regeneron Pharmaceuticals Incorporated, is focusing on an often overlooked but costly and devastating complication of diabetes, vision loss. This eye health initiative, Focus on Diabetes, provides tools and resources for people with diabetes to learn how to reduce their risk of developing eye disease by managing glucose values and getting an annual comprehensive dilated eye examination, even if symptoms are not present. As part of the initiative, the ADA is holding this free educational Q&A. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the ADA is always our top priority. In general, people with diabetes face greater risks of complications when dealing with viral infections, and that is true of COVID-19. The ADA encourages people with diabetes to get vaccinated, and if you have questions about the vaccination, talk to your healthcare provider. ADA also encourages you to follow the guidelines of the CDC. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-342-2383. And now I am delighted to introduce our guest for today's event. Dr. Ryan Coyle graduated Southern College of Optometry in Memphis, Tennessee, where he received special recognition for excellence to patient care. He earned a Bachelor's of Arts degree in biology at Utah State University, and he is certified by the National Board of Examiners in Optometry. Dr. Coyle is a member of the American Optometric Association. When he's not in the office, Coyle enjoys spending time with his wife and their 4 young children. His personal interests include mountain biking, fly fishing, and anything else that gets him out of doors. And I have to say, you live in a great spot for that, living in Utah. Yep. So as we're waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with asking you if you could give us a brief introduction. Can you give a quick overview of the potential for halting the progression of eye disease? Are there treatments out there?
Thank you, Carla. It's good to be here. And I'm very well versed with diabetic eye exams. I do them daily and see quite a few diabetics. And the concern with diabetes is that it often can lead to diabetic retinopathy, which is a condition which can cause damage to your retina, including bleeding and swelling in the back of the eye. And often it develops mildly, and many don't know they have symptoms early on. So it can be prevented. In fact, the CDC says 90% of vision loss related to diabetes can be prevented. And the best way to prevent it, of course, is with an annual eye exam. And unfortunately, quite a few, as many as 60% of diabetics don't get their annual eye exams. And that's the number one thing to do to prevent it.
Great. So catching it early is key.
That is the key. Catching it early and not ignoring any vision loss. If you have any symptoms, which we can discuss here shortly, if there's any doubt, get in to be seen at least yearly and frequently for follow-up if anything changes.
Great. Thank you so much. So now let's start with our first question. And this question comes in from Susan from Delaware. Susan, you are on the line.
Hello, thank you for taking my call. I've been a diabetic since 2005, had cataract surgery 10 years ago, and have had perfect vision up until about February 9th. I had PCO laser surgery on Valentine's Day, had excruciating pain the day of the surgery, and since then I've had double vision in that left eye. I have an appointment with my doctor on Monday. What do I need to ask him? I was told my eyesight should return to normal, and it has not. And I've never had double until now.
Yeah, double vision can be a complication of diabetes. It could be related to that laser PCO procedure you had, or occasionally diabetes can damage the nerves that control the eye muscles. And so your eye care provider will ask you some careful questions to determine how often you're seeing double. Is it just at distance? Is it just when you're reading? Is it constant? Is it intermittent? And based on those answers, they'll get a better idea of what's causing your double vision. So be prepared to answer questions about the double vision as far as, again, how frequently is it? When do you experience it? Is there anything you can do to make the double vision go away?
Thank you. We have another question coming in from Gloria, and Gloria is from Lithonia, Georgia.
Yes, good afternoon. I would like to know what causes dry eye and also what are the best eye drops to use.
Yeah, so good question. Thanks. Dry eyes are extremely common. Unfortunately, our eyes get drier as we age, and the quality of our tears aren't as good. So occasionally, even if your eyes water or tear a lot, that can also be a sign of dry eyes. And there are a couple things you can do with your diet to improve your dry eyes. A diet with omega fatty acids, like you could take a fish oil supplement, and that will help your dry eye. And then also you can use over-the-counter artificial tears, such as Refresh or Sustain. Those are both two very good eye drops. And you can use those on average up to 3 or 4 times a day to help with the dryness. And again, dry eyes are so common. It's a little more common among diabetics as well, as diabetes can damage the nerves that create some of the dryness.
Great, thank you. Here is a question coming in from Sherry, Detroit, Michigan.
Yes, hi. I'm 63 young, and I just, recently found out I was a diabetic, and I went to the doctor last month, but I had these floaters. So, floaters, I see them sometime, and sometime I don't. Are they part of diabetes?
Not necessarily, but sometimes they can be a symptom of diabetes. The back of the eye is filled with a gel called the vitreous. And over time, again, as we age, that gel breaks down and you can develop floaters. So eventually, most people have floaters regardless of whether they're diabetic or not. But occasionally, diabetics will get a unique kind of floater if they're having any kind of bleeding in the back of your eye. So anytime you have new floaters, you want to get seen within days or within a week to make sure that it's not bleeding and that it's just the normal kind of floaters that most people get.
Okay. We have a question coming in from Parveen. Parveen is from San Jose, California.
Hello.
Hi, Parveen, you're on the line.
Hi, good morning. Yes, I am diabetic about 33 years, and I'm having some problem with my eyes. I have floated for a long time, almost 20 years I have floated, but I have been living with that. But right now I have too much eye pressure, and both eyes, and I just went to see the ophthalmologist to do my cataract surgery because it's almost due. and they found my eye pressure is too much. And last 4 months, I have been taking eye drop. And my pressure was 20 and 21. One eye has 20, the other one has 21 or 22. And right now it is getting a little bit lower, like 19. Last 3 months, I have been using the eye drop. I just would like to know, is this eye drop is too much, or it has side effect, or at which level I can do the cataract surgery?
Yeah, I missed the very last part of that question. I believe
It
you
was
were
when
asking about what?
cataract surgery. When could she do cataract surgery?
Yeah, so first of all, you talked a bit about glaucoma and your eye pressure, and I do want to point out that diabetics are twice as likely to get glaucoma as the general population. So another benefit of your annual eye exam is to check that pressure regularly. So it sounds like you're on a drop to lower your pressure. Typically, eye pressure should be somewhere between 10 to 22, and the goal, of course, with your eye drops is to lower that pressure to a healthier range, often below 20. And so your primary eye doctor will work with you to get your pressure to that right number. You do not have to wait to have cataract surgery until your pressures get lower than that. Typically, a pressure of 20 is appropriate for cataract surgery. So it sounds like you could proceed with cataracts when you're ready and they're ready.
Sounds good. Okay, I have a good question coming in here, and I think we can talk about this a little further. And that's coming in from Dina from New Jersey. Dina, you're on the line.
Thank you. I'm a pre-diabetic, and an eye doctor told me I do not need to have a dilated eye exam. You mentioned before having them, and help, I want to know, should I be going to someone who will do a dilated eye exam?
Yeah, good question. Dilation is an important part of an eye exam, whether you're diabetic or not, because with dilation, it's more thorough. It really opens your pupil so the doctor can see the back of the eye. So it is recommended. Now, some providers use cameras to take a picture of the back of the eye instead of dilation. And having a photo taken, it is a nice tool, and that is certainly better than not having anything done. But dilation is even better than the photo. Some places will do both, a photo and dilation. But yes, I would request or ask your provider to dilate you regularly. Ideally, annually, when you're diabetic and pre-diabetic.
So I think one question that I think people always ask is, is a dilated eye exam important even when they're seeing well? I mean, I think we sometimes think of retinopathy as a silent disease. Could you expand on that?
Yeah, good point. Diabetic retinopathy, again, it damages the small blood vessels in the back of your eye. And in its earliest stages, the damage and the changes are very subtle, and you often have no symptoms. And so regardless of whether you're seeing well or not, I would recommend, or the CDC recommends, an annual eye exam with dilation. Once you're dilated, we look carefully at those blood vessels to see if you're having any mild or moderate retinopathy. Initially, what we look for are small changes to the blood vessels. They can start to bulge. You can start to get little pinpoint spots of blood that we call dot hemorrhages. And they can often be missed and ignored if we're not proactively looking, even when you have no symptoms.
Yeah, and I think that's one of the big keys to that prevention, that 90% prevention of vision loss, is making sure you're getting your eye exam. Here's a written in online question. My optometrist told me that one of my eyes is bleeding. She asked me to see her after 3 months to follow up. Is it dangerous? Should I see someone earlier?
Right. When we see retinopathy or bleeding in the back of the eye, we categorize it as either mild, moderate, or severe. And based on the degree of severity, that tells us how often you should be seen. So, for example, if we see someone with very early mild bleeding or retinopathy in the back of the eye, we may say we just want to see you in 9 months to check again. If it's more of a moderate level, that's where we tighten up the follow-up to more like 3 or 4 months. So it sounds like that's an appropriate recommendation, the 3 months, based on what they saw in the back of your eye. Now, occasionally we'll see severe retinopathy, and if it were severe, the bleeding would be heavier, and in that case, you would be seen quicker, sometimes within days or weeks. But again, assuming that she saw moderate retinopathy, 3 months would be appropriate.
Thank you. This question comes in from Alice. Alice is from Brick, New Jersey.
Hi, I'm a type 2 diabetic, and I have macular degeneration. In the last year, my reading, like the newspaper in particular, has gotten very, very poor. I need a lot of light to read, and I also take pressure vision, AREDS 2. Doctor told me that prescription glasses will not help, just to use over-the-counter glasses. Is there anything else I can do to help me read better?
Yeah, good question. Sounds like the macular degeneration has really limited your vision. Lighting, of course, is crucial. It's very helpful to have very good lighting on your material. You want to have the right magnification, that your primary eye doctor can tell you what number of magnification to use. Sometimes, though, that's not enough. You could ask, if your vision is very limited, you could ask for a referral to a low vision specialist. And these are eye doctors that specialize in helping people with limited vision. And sometimes your vision's limited. It can be limited from diabetes, from macular degeneration or glaucoma. Regardless, a low vision specialist can show you different devices such as magnifiers, sometimes even scopes, telescopes, to boost your vision. And so it sounds like that might be worthwhile for you to find out if there's a local low vision specialist.
That's a great idea. A great idea. If you're just joining us, welcome to today's Ask the Experts event. My vision keeps getting worse. Can it be saved? As a reminder for those of you on the phone, press *3 on your keypad and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player, press the Submit Question button, and your question will come directly to us. Here's a question coming in from Gary. Gary is from New York.
Okay.
Hi, Doc. Wanted to thank you for doing this today, but my question is about general diet, food and drink that might be, if you have 2 or 3 recommendations of things that would be very helpful, eye health-wise, and if you have 2 or 3 things that would be definitely things, food and drink to avoid, if there are any. Thank you.
Great. Yeah, thanks for the question. Of course, the big ones, smoking, you want to definitely stop smoking, avoid smoking, as that is very harmful to the eye for many conditions, including macular degeneration and diabetic retinopathy. Limited drinking as well, which can be harmful to the eye. In general, things that are very helpful to the eye would be a diet with high antioxidants, such as leafy greens, omega fatty acids. Beyond that, I don't work with my patients with nutrition as much as, of course, as their primary care physician. So I just strongly recommend that they work with their nutritionist or their primary care physician to get their diet right, to tightly control their A1C level, because keeping your A1C level low goes a long way in preventing diabetic retinopathy.
Good. We have a question again coming in online. Can you talk about the effect of hypoglycemia and hyperglycemia on the visual parts of the brain, short and long term?
Yeah, so fluctuating blood sugar levels can really cause some intermittent blurry vision. So we've talked a bit about how diabetes can cause diabetic retinopathy, which is bleeding on the back of the eye, but fluctuating blood sugar can also affect the lens that's inside your eye. That lens can swell when your sugars are high. It can go back to size when the sugars improve. And if that's happening, you'll get some pretty significant shifts in your vision. And often for some people, that's the first sign of their undiagnosed diabetes. And for others, it's a sign that their diabetes is not well controlled. And so if that is caught and the blood sugar is improved through diet and exercise, the lens will go back down to size and the vision will improve.
Great, thanks. All right, we have a question coming in from Margaret, and Margaret is from Florida.
Hello. I'd like to find out what causes you not to be able to see momentarily. For instance, about 3 nights in a row, I got up to go to the bathroom. I went completely in the dark, and when I cut on the light in the bathroom, everything in there was dark for like seconds, and then it became normal. And that happened like 3 times. So I called the doctor. I have a doctor that gives me injections behind my eye due to diabetic retinopathy. And he just left with the words with the girl to just tell her to call an ophthalmologist. Can you tell me what causes that?
So, yeah, sounds like you're having some momentary vision loss when you get up, especially, I think you said at night. If you're getting up out of bed and then shortly after temporarily losing vision, it's going dark, it very likely is a blood pressure issue. In some cases, your blood pressure can be momentarily too low when you go from laying down to standing up, and it takes the body a moment for that blood pressure to regulate to the right level to get the blood up to the eyes. And that may be what's going on if it just goes dark for a few seconds until things stabilize. So if that were the case, you would want to sit up out of bed slowly before standing, just to allow your blood pressure to regulate. But that does, it could certainly be something other than that. So it does sound like a visit to your ophthalmologist would be in order to make sure there's no other issue going on. But that would be my first thought, is it's related to your blood pressure.
Okay, we have a call coming in from Carol. Carol is from the Bronx, New York.
Hi.
Hello.
Can you hear me? Yes. Hi. I have diabetic retinopathy, and I've had it for a while, and for many years, and I've had many laser treatments done. The last ophthalmologist that I seen, I see an ophthalmologist now every 6 months, but the last time I saw him, which was 5 months ago, he said to me that laser actually would not be an option for me, that they have other treatments should I need them that would be available. I want to know if laser is no longer like an option for me, what would be some of the next things that they might be able to do. Now, I tell you, I see now, I think my vision is like 25 something or the other, but I don't wear very thick glasses. In fact, they're not thick at all. So, yeah, I'm just wondering what would be the next thing that might be available to me.
Okay, great, good question. So, when the diabetic retinopathy advances to a more severe level, where there's significant bleeding in the back of the eye, often an ophthalmologist will use a laser to help seal off some of those damaged vessels to stop the bleeding and to prevent further bleeding. Now, if they've already done laser on your eyes, there's just a limit to how much they can do. So it may be that they've reached that limit. As far as what else they could do for your eye, in some cases of severe retinopathy, they will actually inject a medication into your eye, because when you have severe retinopathy, new blood vessels start to grow into the retina to try to improve the blood flow, but these new blood vessels are often really weak and fragile and leaky, and they can cause more problems. So an ophthalmologist will inject a medication into your eye to stop the bleeding, which is used to stop also swelling if you have swelling at the center of your eye that causes blurry vision. And those are the two main treatments, the laser and the injections. Beyond that, in very severe cases, there's also a surgery that's done to remove the gel from the back of the eye. That, again, that's not as common. The two more common are the laser and the injection. So I suspect that's what they may have intended for you.
Thank you. So if an individual is already lost vision, is there an advantage to continuing with their dilated eye exams, and what would that be?
Yeah, good question. Often there will already be some permanent vision loss in one or both eyes, but yes, they should continue to have annual eye exams, because even limited vision often can get worse. So often the retinopathy will leave you blurry where you're only able to see the top of the eye chart. But even that kind of vision is very beneficial, and it can get worse to the point that in some cases you can lose the ability to even see light out of the eye, which can be very devastating and difficult. So there's generally some level of vision to be protected.
Great, thanks. This question comes in from John. John is from Arlington Heights, Illinois.
Yes, thank you for taking my call. I have been noticing over the last 2 to 3 weeks, maybe a month, that I have been noticing floaters that are solid black and sometimes take on the appearance of figures. Is this, I heard the earlier comment that it could indicate bleeding in the eye. I've been diabetic for 30 years. I have good vision now. I'm 20/20 with my soft lenses, but I'm just, it raised a question that maybe I ought to make an appointment with my ophthalmologist and have those looked at.
Yeah, good question. It sounds like you've been able to control your diabetes pretty well, for that many years, and it sounds like your vision's pretty good. But yeah, there's the floaters you're noticing. They can be a sign of diabetic retinopathy. Again, often they can just be the normal age-related type floaters, and if you've had floaters for years and you just notice them here and there in certain lighting, generally that's not a concern. But anytime you have new floaters that you feel like weren't there before, that's definitely worth checking out. So these floaters you have, just think about how long you feel like you've had them. Are they new? But it sounds like it probably would be worthwhile just to have a dilated exam to be sure that they are just the normal floater and not a sign of any kind of bleeding in your eye.
Thank you. We have a question coming in from Irma, and Irma is from New Brunswick, Texas. Irma, you're on the line.
Oh, okay. Hello. My question is a little complicated. I am diabetic and have been for, probably over 20 years. But I have had cataracts removed, and I have glaucoma. So I've been on the eye drops. But somehow I developed this corneal abrasion that has not healed, and I have had to have a corneal transplant. In fact, I've actually had two, and it's still not healing. But in between here, lately, one of my internists, I had to go see my internist in between there, she said, which one of your doctors is doing your diabetic eye exam? And I'm going, oh my gosh, I've had like 3 different doctors. I have 3 different eye specialists for my cornea, and then I had to have some eyelash surgery done because one of them thought that it was eyelashes that were going in that were preventing my cornea to heal.
Mm-hmm.
So I asked one of them, okay, my internist wants to know who's doing my diabetic eye exam. And I'm thinking because for the retinal hemorrhage type thing. And he said, oh, well, I could do it. I can do one now. So I thought, oh, my gosh, nobody's been doing it. So I would think that they all know I'm diabetic. Would they not be able to see if I have some kind of bleeding in my eye, even though I have that abrasion in there? Because he said, well, we really can't see too much with the abrasion in there. So I'm going like, oh, my God. So I don't know. Maybe if I have bleeding in there, would it be keeping it from healing, the corneal abrasion?
Yeah, great question. Typically, any issue in the back of the eye, like retinopathy, that shouldn't be related to your slow healing on your cornea. That sounds like a different issue. And it's true, sometimes if you have a cloudy cornea after your surgery that's not healed well, they may not be able to get a good view of your retina for a while until that cornea starts to clear. Hopefully that's not too long so that they can still be looking back there regularly. But again, I don't think that would be the source of your slow healing cornea. And again, as soon as they get a clear view through that cornea, one of those doctors should be watching you carefully for your diabetes.
Great, thanks. We have a question coming in from Roma. Roma is from Austin, Texas. Roma, you're on the line. It's hard to hear, Roma, but I will mention what she has. She's had retinopathy and wonders if it can ever get better or if it's just the damage is done moving forwards and it's just stopping the progression.
Yeah, really, the key to limiting the damage is, of course, to catch it early. So in your case, Roma, whether it will improve depends on what level of retinopathy you had and how early it was caught. But yes, generally and often the damage can be improved and controlled. Again, depending on the severity, they may do laser treatment. They may inject a medication into your eye. Those kinds of treatments often improve the vision. Occasionally, if someone has some retinopathy that's been there too long, there are occasions where it cannot be improved. And at that point, we have to just work to prevent further loss. So really, it's a question of timing, which is why it's so important to just get in often and frequently.
Great. Just to let you also know, everyone, that for more information on eye health, visit the eyehealth.diabetes.org website. And that's another place where you can see some links to more information on eye health. All right, let's go with our next question. It comes in from Nancy. And her question is it safe to do LASIK surgery?
Yes. LASIK is a very common, very popular procedure. I believe it's been done for at least the last 20 years or more. So in my day-to-day clinic, I'm an optometrist. I do a lot of primary eye care. So through the course of my day, I do diabetic eye exams, but I get quite a few LASIK patients too that come in after the procedure. And generally, it's a very well-tolerated procedure that they're really happy with. Of course, there's always a chance for complication, but that's really rare with LASIK. And have your annual diabetic eye exam. And when they do that diabetic eye exam, they can also tell you if you're a good candidate for LASIK or not. Generally, diabetes is not a contraindication for LASIK.
Great, thanks. We have a question coming in from Becky, and Becky is from Lexington, Kentucky.
Yes, I'm a type 1 diabetic. I've been for 58 years, and I have glaucoma and retinopathy, and I've had vitrectomy in one eye. And in this particular eye, I have no peripheral vision on that side. Is there any way to improve your peripheral vision, or is it pretty much gone?
Yeah, good point. Good question. If you've had some damage to your peripheral vision, generally that change is more often than not it's permanent, so it may not come back. Especially if it's related to your procedures that you've had done with diabetes, it's probably permanent. Now, there can be some modifications done to glasses to improve your peripheral vision. Sometimes your eye care doctor, your optometrist or ophthalmologist can put what we call prism into your glasses. And that prism can shift your vision one way or the other to improve your peripheral vision if there's just one spot that you're really missing that's bothersome. So that might be worth asking at your next checkup is whether prism in your glasses would be worthwhile.
Great, thanks. So this question comes in from Martha from Brooklyn, New York. Martha, you're on the line.
Yeah, I have been using eye drops for years for pressure in my eye, but I was told about glaucoma surgery. How safe is that, and do you have any latest information about it?
Questions about glaucoma surgery?
Yes.
Yes.
And did you say, are you already on glaucoma drops?
The answer to that is yes. She did say she was on drops.
Okay, got it. Yes. Yes, so typically with glaucoma, our first line treatment are eye drops. You're often placed on 1, 2, sometimes even 3 daily eye drops, which work well, but it can be tough to keep up with drops. And so if the pressure is not controlled well enough with drops, or you're unable to get the drops in, there are a number of glaucoma surgeries to consider that are safe and effective, including when you have, sometimes they're done at the time of cataract surgery. They can make a glaucoma procedure then as well. Other times they're just done in office. There's a laser procedure that can be done to lower your eye pressure. So yes, there are some really good options for glaucoma surgeries to explore. Again, good question when you have your next eye exam.
Great. This question comes in from Shirley, and Shirley's from Atlanta, Georgia.
All right.
Okay, hi. I've been diabetic for about 20 years, and I also have a condition called Duane's syndrome. I've had cataract surgery on both eyes, like maybe a couple before the pandemic, but I truly didn't see a difference after that in my vision. But what's happening in the last 4 or 5 days is I've noticed a fluttering of the lower left eyelid. That and a kind of a slight pulling of the eye, not closing, but a little bit. And with Duane's syndrome, there's, the eye kind of appears smaller in a way. So I'm just wondering if this fluttering is something I need to be concerned about.
Okay. Yeah, good question. It may be what we call myokeemia, which is when you can have there's little eye muscles in the eyelids, and sometimes they can flutter on and off for several weeks. And it's just like a little twitching of the muscle in your eye. Usually that's not a concern. It's often a symptom, or it's often caused by either fatigue, too much caffeine, or stress. Occasionally it can come on for no apparent reason. But again, if it's just the small little muscles in your lid that are twitching, that's okay to just watch it. It should go away within a couple weeks. Now, if it lasts longer than that, or if the muscles are larger than what I'm saying, if it's muscles in your cheek or forehead, you'd want to get right in to have that looked at. But if it's just the tiny muscles in your lid, that can be watched to watch it go away in 2-3 weeks.
So another question, and the difference between type 1 and type 2 and their first eye exam, maybe you could clarify why there is a difference. So type 1 diabetes generally within the first 5 years, and with type 2 diabetes, it's right on diagnosis. Could you kind of tell why that is? And is that something you agree with?
Yeah, that is a written recommendation. I know the Academy of Ophthalmology has that recommendation that yes, when you're type 1, have your first exam within 5 years, and if you're type 2, immediately and every year after. Generally, I just recommend every year is a good idea, even for those type 1 diabetics. But I believe the recommendation is based on just the numbers show that when you're type 1, generally you're younger, and generally the retinopathy is, there's just not many cases of retinopathy for type 1 diabetics in those first few years. And that's why they said you can wait up to 5 years. Whereas with type 2, often there will be retinopathy sooner. And so for them, we say every year. But in general, I think it's a good idea just to do annually from the get-go with either type, just to start creating that annual habit so nothing is missed.
Good. So Barb from Georgetown writes in on an online question. In general, for a person with type 2 diabetes, how often should I expect to need a new prescription for my vision? Annually or more frequently?
So yeah, like you said, certainly have your checkup annually, but as far as how often you'll need to update your glasses, that can really vary. If your blood sugar is not well controlled, that will lead to frequent changes, probably annual changes. But if you do a pretty good job of controlling your blood sugar and keeping your A1C level low, then there wouldn't be any reason to need more frequent changes than anyone else, which for most adults, often the prescription is good for 2-3 years or longer.
Great, thanks. Ophelia Ray from Pensacola, Florida. Ophelia, you are on the line.
Yes, I am. I'm a type 1 diabetic. I've been a type 1 diabetic for 61 years. I had laser surgery. I've had all kinds of surgery with my eyes. My right eye is in good shape. I can see very well with my glasses on with my right eye. It's my left eye. It's a blurred, and nobody can tell me why this left eye is blurred, even with glasses on.
Okay, well, that is concerning when you have one clear eye and then that blurred eye, even with the glasses on. Sounds like, in your case, maybe you at some point did have some retinopathy going on. I know you had the laser procedure done. Typically, retinopathy occurs in both eyes, but not always to the same degree. So it's possible that you had more advanced retinopathy in the one eye. Occasionally, the retinopathy can cause some scarring and some permanent vision loss. So it's possible that that left eye just had more advanced retinopathy and scarring. But when you have your regular checkups with your eye provider, of course, they can do some more specific testing. Sometimes we do a scanning laser to identify where the source of the vision loss is from. So they ought to be able to tell you a little better why that vision's so limited in the left eye compared to the right. But sometimes that is the case. Again, that one eye just has a more severe case than the other.
Thanks. We have a question coming in from Ike. Ike is from New York.
Yes, hi. I have some kind of problem with my eye, and I have to rub it or either find myself squinching trying to see. What caused that?
Yeah, good question. The most common cause of intermittent blur that comes and goes is it's often just dry eyes. So if you ever feel like you have to pause and rub your eyes to see better, especially if it's later in the day when you're tired, it's probably dry eyes. Um, Again, if it's coming and going. And in that case, you would just try an artificial tear over the counter, something like Refresh or Sustain or Blink tears. I would put a tear in 2 or 3 times a day to see if it helps that problem. And of course, you still want to see your eye doctor to rule out any other bigger sources of that problem, because blurry vision that comes and goes can be related to poorly controlled diabetes too. So not to make it overly simplistic, it could be dry eyes, but of course, check up with your doctor to make sure it's nothing more serious.
Great. And a reminder, at the conclusion of the Q&A segment, you are welcome to stay on the phone or online to complete a short 5-question survey. Your feedback is very important to us and will help to inform for future planning. You've been asking great questions, and we hope you will participate in the closing survey. And to remind you, if you're on the phone, select *3 to ask your question. It'll be put in a queue, and then we can get to your questions. All right. So we have a question coming in from Helen. Helen is from Chicago.
Hello.
Hello, Helen. You're on the line.
My question is, good morning. My question is, I had eye implants put in maybe 10 years ago, and I had 20/20 vision at that point. But now it's beginning to deteriorate. And I was wondering if it would benefit me to have another surgery.
Okay, yeah. So it sounds like you had cataract surgery and they put in lens implants into your eye. You were really clear, but it's been getting worse, and you're wondering about another surgery. You know, whether or not to have another surgery largely depends on the source of the blurry vision. So sometimes after cataract surgery, the implants can develop a hazy film on their backside. That can be watched for during your annual diabetic eye exams. If they ever see that your implants have a film on there, they'll use a laser. An ophthalmologist will use a laser to clean that film off. It's called PCO. It's easy to watch and catch for. So if you ever get that, then yes, that would be an easy procedure to have done. Beyond that, though, cataract surgery typically is not repeated. And then they'll take a careful look at your retina to make sure there's not some other source of your blurry vision, which, again, if there's any retinopathy, that could cause a little swelling, bleeding in the back of the eye. And if that were the case, they could also treat that with a laser treatment or with a drug injection into the eye. So there's a possibility you could have some kind of procedure for that blurred vision, but not cataract surgery again.
Thank you. So one question I hear in my practice is, do I go to an optometrist for my annual eye exam, or do I go to an ophthalmologist? Because you kind of clarify that for folks on who does what when.
Yeah, no, great question. I think there's really good synergy between optometry and ophthalmology. In fact, we often work side by side. I happen to work for the University of Utah, where I work alongside a lot of ophthalmologists. And so the answer is you can get great diabetic care from both optometry and ophthalmology, especially if you're just looking for your annual diabetic exam. You can go to either and have the same great care. So it's often a matter of your location, who's nearby. Often optometrists are found more in some of the smaller, more rural communities. So sometimes it's easier to get out to an optometrist, and they do a great job. Ophthalmologists, they're a little more headquartered in bigger cities. So if they're nearby, they're great. Now, if you see an optometrist, we can watch you carefully for any retinopathy. If we see it get to a point where you need surgical treatments, again, such as laser, drug injections, at that point, we would refer you to an ophthalmologist. As optometrists, we do primary eye care, but we don't do surgery. So we can easily diagnose and catch those issues and get you to the right surgeon. So the important thing is that you see one or the other. and then follow their recommendations on referrals if they need to send you to someone else.
Great. We have time for one more question. This comes from Marcia from St. Louis, Missouri.
Hi, thank you for taking my call. I have had diabetes type 2 for about the last 10 years, and I am 75 years old and had the diabetes for 10 years, and it is well controlled with metformin. My A1C is always less than 6, and as a child, I had an injury to my eye, and then about 15, 20 years ago, I had a chemical damage to my left eye. And I've had cataract surgery. That was probably about 6 years ago. And I started feeling like I had an eyelash stuck in my eye. So I would go to my ophthalmologist that I had been seeing for 15, 20 years. And he, took out the eyelash, and my eye felt better for a while. And then I felt it again, and I went back and did it again, and things seemed to be better. And then again, and that time when I went back, he told me that I had a cornea abrasion, and that mentioned just to use eye drops. And I did after that, and I used Refresh. And but he told me, there really wasn't anything else they could do, and to just come back in a year. And I wasn't particularly happy with that answer. So I then became associated with an optometrist at Washington University Hospital here in St. Louis. And they explained that I do have corneal, is it keratopathy, I think it is, and the basement membrane is damaged. And she told me to continue to use the eye drops, and I do use Refresh, and that does help in the daytime. And then at night, I use Muro 128 eye ointment in both eyes. Both eyes are damaged, but I don't, only the left eye bothers me. The right eye does not. I didn't know it had a problem. I just wonder, is there anything more that you can tell me about this, or anything more that I can do to help? It's disturbing that I can't read, and like I said, I can use a magnifying glass, but you can't really do that for very long before the eye gets really tired.
Yeah, no, good question. Yeah, it sounds like your cornea is not nearly as clear as it should be, which can really compromise your vision. So that makes it tougher to get your reading done well. So again, make sure you have very good lighting when you're reading and the appropriate glasses. It sounds like you are on the right drops. You want to lubricate your eyes often. You can use Refresh in the bottle 3 or 4 times a day. You can also use preservative-free tiers that are in the individual vials. When they're in the individual vials, there's no preservative, so you can use those more frequently, as often as every hour if you find it helpful, especially when you're reading. And then they did well to get you on the Muro 128. That's a great drop to use overnight to help keep your cornea clear. So maintenance goes a long way in preventing problems, so just use those drops regularly and often. And then when you have your regular diabetic eye exams, they can check for any kind of corneal scarring. Sometimes if the cornea starts to get scarred, there are some surgical procedures that can be done. But in your case, it sounds like there's no scarring. So the drops and the Muro 128 sound great. So I think you're on the right track.
Thank you. That wraps up our last question. Could you give us 3 take-home messages that you want everyone to be aware of on this call?
Yeah. Thanks for having me. This has been fun. 3 take-home messages. Well, one would be that the majority of vision loss related to diabetes is preventable, up to 90%. So if it's preventable, then that speaks to getting seen regularly. So get your annual eye exam would be my first recommendation. Even if you're not having symptoms and it seems like just one more thing to do when you're busy, it's worth it because it can catch problems early. My second recommendation would be to not ignore new symptoms between your annual eye exams. If you suddenly start having decreased vision, blurred vision, new floaters, double vision, if something seems off, I recommend that you get in, typically within days or a week, just to catch problems early. So that's my other item. Don't ignore new symptoms. And then the third thing is just work to keep your A1C level down. So annual eye exams are important, but more important are diet and exercise. Work with your primary care doctor to get your medications, your diet, and your exercise all dialed into their appropriate level so that you can avoid vision loss.
Thank you.
And those would be my three. Thanks.
A few items before we close today. Consider staying online for our short 5-question survey. We want to hear from everyone. To help you feel confident about your ability to prevent and treat diabetes-related eye diseases, we encourage you and your loved ones to talk to your healthcare provider about your risk, schedule an annual dilated eye exam, whether you have symptoms or not, and register for the next event at diabetes.org/experts. All of these links are on the Ask the Experts registration webpage, diabetes.org/experts. We're sorry we're unable to get to all of your questions. If you have questions about this event, you are welcome to contact askada@diabetes.org or by calling 1-800-342-2383. ADA is here to support you. Special thanks to our expert, Dr. Ryan Coyle. I am Carla Cox. On behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you on our next Focus on Diabetes Ask the Expert event, May 24. What in the world is happening with diabetes eye disease? And the No Diabetes by Heart ATE, April 12, Spring into Action, Exercise and Diabetes. Please stay on the line for a short survey portion to close out our program. And once again, thank you so much, Dr. Coyle, for being with us. Okay, now on to our survey questions. Thank you again for joining us. We appreciate your feedback on today's event. To provide the responses, press the corresponding number on the keypad of your phone. For participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here's our first question. Overall, how satisfied were you with today's event? My vision keeps getting worse. Can it be saved? Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. Overall, once again, the question is, how satisfied were you with today's event? My vision keeps getting worse. Can it be saved? And the scale is from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. So press 1 for not at all satisfied, 2 for somewhat satisfied, 3 for neither satisfied or dissatisfied, 4 for somewhat satisfied, and 5 for very satisfied. While we take a moment for the next question to come up, I would like to let you know that if you missed part of today's event or would just like to listen again, we have full recordings available by phone. Call the toll-free number at 866-686-8240 to hear the latest recording. Okay, on to our next question. As a result of the event, to what extent do you feel confident that you can reduce your risk for diabetes eye-related disease? Press 1 for not confident, press 2 for somewhat confident, and press 3 for very confident. Again, question number 2. As a result of the event, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Press 1 for not confident, press 2 for somewhat confident, and press 3 for very confident. While we wait for question 3 to load, I'd like to let you know that you can find resources related to this event on our website, diabetes.org/experts. Click on the March 22 event page, under past recordings to find links to our eye health resources, as well as full recordings of this event. Now on to question 3. John is a 32-year-old man with type 2 diabetes. He has no eye symptoms. Does that mean he does not have diabetic eye disease? Press 1 for yes and press 2 for no. Once again, the question. John is a 32-year-old man with type 2 diabetes. He has no eye symptoms. Does that mean he does not have diabetic eye disease? Press 1 for yes and press 2 for no. While we wait for question 4, I'd like to mention that for additional information on managing diabetes, you can enroll in an ADA recognized diabetes self-management education program. This program will help you gain the knowledge and skills and confidence to thrive with diabetes. You can find a link to a program near you on our website, diabetes.org/experts, or you can call a member of our call center at 1-800-DIABETES. All right, question number 4. Maria is 54-year-old and was just diagnosed with type 2 diabetes. When should she have an eye exam? Press 1 for within 5 years from diagnosis. Press 2 for within 3 years from diagnosis. Press 3 for within 1 to 2 years from diagnosis. And press 4 for at the time of diagnosis. Once again, Marie is 54-year-old and was just diagnosed with type 2 diabetes. When should she have an annual eye exam? Press 1 for within 5 years of diagnosis. Press 2 for within 3 years from diagnosis. Press 3 for within 1 to 2 years from diagnosis. And press 4 for at the time of diagnosis. Before we go on to our final question, number 5, remember that our next Ask the Experts Q&A event for Focus on Diabetes will be May 24, Diabetes Eye Disease, What in the World is Happening, at 2 p.m. Eastern Time. Our guest expert will give you a glimpse into eye disease and what is happening worldwide and answer your questions on prevention and treatment. So our final question, number 5. Rod is a 57-year-old man with type 2 diabetes. Which of the following will help reduce the risk and slow the progression of diabetic retinopathy? Press 1 for sugar glucose control. Press 2 for a comprehensive dilated eye exam. Press 3 for both A and B, or 1 and 2. And press 4 for vitamin D. Once again, number 5, Rod is a 57-year-old man with type 2 diabetes. Which of the following will help reduce the risk and slow the progression of diabetic retinopathy? Press 1 for glucose sugar control. Press 2 for a comprehensive dilated eye exam. Press 3 for both 1 and 2. Press 4 for vitamin D. And that ends our survey. We offer many thanks to today's expert, Dr. Coyle, as well as our support vendors and visionary partners, and the Focus on Diabetes initiative. This concludes today's program in our Ask the Expert series. Stay well. Thank you for joining us.